Hey everyone, I'm ALISON Morris. You're watching NBC News Now. At this hour, America is an important step closer to a coronavirus vaccine. An FDA panel voting tonight to recommend emergency use authorization for Pfizer's coronavirus vaccine. Official approval from the FDA could come tomorrow. Once it does, the U.S. will start delivering doses within 24 hours. That means Americans could potentially start getting vaccinated this weekend. But even if we are close to a clinically approved vaccine, health officials caution this pandemic is far from over.
We will be immunizing 20 million people in December, another 30 million in January, another 50 million in February. But the reality is right now, we've got to do what we've been telling everyone to do, and that is wear a mask, physically distance, avoid crowds, because those numbers are going up, and the vaccine will not provide immediate relief.
Right now, the infection levels across the country are the worst we've seen. Nearly 223,000 new cases were reported Wednesday, according to our own NBC News data. Almost 107,000 people are in the hospital, according to the COVID tracking project. And yesterday, more than 3,000 people died for the first time during this pandemic. The total death toll in the U.S. now more than 292,000. Former CDC Director Dr. Tom Frieden saying on Twitter, if I were to tweet once every hour the name of an American killed by COVID, it would take 33 years to honor every person we have lost so far. In Arizona, 90% of the ICU and hospital beds are occupied, and this week, total deaths in that state top 7,000. NBC News correspondent Steve Patterson is in Phoenix. Steve, coronavirus cases are putting a strain on Arizona's healthcare system, but there is one hospital, St. Luke's Medical Center, that is completely empty, no patients. What is going on there?
Well, it's a bit of irony, actually, Allison. This hospital shut down last year in 2019 because of this reason, because they weren't drawing enough patients. Think about that. Now the state is bursting at the seams with COVID patients. They need help literally all over the state. And now the hospital may reopen because it's being seen as sort of a last resort. It is what's called a warm site, which is essentially health officials see it as a way to quickly spool up in the event that the state reaches full capacity and there are simply no beds anywhere. They could reopen this in about 7 to 14 days, offering another 235 beds for what they call post-acute care. That is people that are still sick with COVID, sick enough to be in the hospital, not receiving the top-level care, but not yet well enough to go home at that point. So that's what that facility would be used for. They still, again, see it as a last resort. They want to do anything before they put people in that hospital. It is unlicensed at this point, so they like to use some of the care providers that they've contracted with over the last few months. But again, it is so bad. The numbers are trending very heavily to make it seem like capacity is only probably about a week away. In fact, the largest health provider in the state says that they will be at 100% capacity by next week at 125%. Just a few days after that. The crisis is reaching levels that we have not seen yet in this pandemic. And here in Arizona, it's getting pretty dire. Back to you.
Oh, Steve, that is some scary stuff. But there is potentially space for more patients. Healthcare workers, though, telling you that they have some concerns. What have they been saying?
So, yeah, the concerns are I think, what you're alluding to. Space for more patients is great. They're looking everywhere, all across the state, to try to come up with more beds. The problem is, even if they find more beds, beds don't treat patients. Beds are just, spaces to house patients. And while that is necessary, they need specialists. You need nurses, you need doctors, you need nurses and doctors that are specifically trained to handle ICU equipment, trained in intubation. And right now there's, alongside a crisis in capacity, there's also a crisis in staffing. That is what physicians, doctors, nurses are most concerned about at this point. Help is not on the way because the crisis is everywhere, so you can't pull from other states. You can't pull from other health systems within the state. You're really out on your own, and that makes it very difficult when the ratios are so overwhelming with so many patients flooding into ERs and ICUs and COVID wings. I spoke to a physician about that and about what they're seeing on the ground here in Arizona. Here's what he told me.
It's probably worse than it was this summer because this summer, at least we had resources to draw upon from around the country because, in the summer we were one of the few hot spots, and now the whole country is a hot spot. It's not just about the number of beds available, but it's about staffed beds, because you need nurses, you need doctors, you need hospital staff to actually be there. And we're running out of that not only in Arizona, but around the country.
Meanwhile, the heads of most every major health provider in the state met yesterday. They held a conference call. One of the things they wanted to put out there was the demand to the governor and the state to do more, institute a statewide mask mandate, institute a curfew, ban indoor dining. Those precautions have not been taken yet. They'd like to see that happen so they can help stop or at least slow down the spread here in Arizona, which is, again, running rampant. Allison.
Can certainly understand that. Steve Patterson in Arizona, thank you so much.
Thanks.
An advisory panel of scientists and health experts expected to recommend the Pfizer vaccine for FDA approval. If that happens, how will Americans start getting those shots? NBC News correspondent Morgan Radford is in Silver Spring, Maryland, with the distribution plan.
Allison, this is a 23-person advisory committee that's independent of the FDA. And the bottom line is that today they will vote on whether or not they recommend the emergency use of the Pfizer vaccine. And the FDA, if they authorize it, they could do so as early as tomorrow. And if that should happen, that means that millions of doses of this emergency vaccine will then go to every corner of the country. But the question is, who will get that vaccine and who will get it first? We do know that priority will be given to elderly Americans and also to those frontline healthcare workers. But one of the biggest hurdles, Allison, is this issue around trust. Only 61% of Americans, according to the most recent Quinnipiac poll, said that they would get this new vaccine. But health officials say they really need to see about 75% to 85% of the general population receive this vaccine to kind of try to reach that critical herd immunity and make this vaccine really effective. Now, what we also know is that this is a vaccine that requires 2 separate doses 21 days apart. And so far, it appears to be effective across racial lines and ethnic lines, and even effective in people who have certain comorbidities like obesity or diabetes. But one thing they do not know yet about this particular vaccine is if it's effective in children under 16 or among pregnant women or people who have compromised immune systems. So those are some of the questions that people have that are still lingering. But we also know that there is an elaborate distribution plan that is already in place once this vaccine is in fact authorized. That means that the vaccine will actually leave those Pfizer freezer farms that are in the Midwest, and with the help of the military and UPS on the East Coast and FedEx on the West Coast, those vaccines will leave the Midwest in boxes that have GPS trackers and that keep that vaccine at negative 80 degrees Celsius, which is what it needs. And in that first dose, we'll see 2.9 million doses of the vaccine set out, and then later we'll see that same amount set out for that second vaccine dose that is required to make it effective. Allison?
Emergency use authorization for Pfizer's vaccine cannot come a minute too soon. The U.S. just shattered its daily death record. 3,103 people died of COVID yesterday. That's more than 9/11. The best way out of this? A vaccine.
We need to get to herd immunity, and that requires a substantial percentage of Americans to be vaccinated. So that's why we've been transparent. It's why we want this public discussion of the data. It's why we've been very careful about the review of the data, and we'll make a very careful decision, understanding, of course, the importance of the situation and the urgency of the situation.
Joining me now, Dr. Bob Lahita, chairman of the Department of Medicine and St. Joseph's Healthcare System. Dr. Lahita, the situation in the U.S. really bad right now. If the Pfizer vaccine gets a green light today, how long would you say before it starts making a real difference?
Okay, Allison, good to see you as always. This vaccine is not going to make a difference immediately because you heard from the last report that the surefire effective vaccines, as we saw with the polio vaccine, was herd immunity, which requires about 70% of the population to be either immunized or infected. And then the virus kind of gives up and says, I can't infect any more people with great efficiency. So with regard to myself and my colleagues who are on the front lines, when we get our vaccinations after 21 days, the second vaccination, we should then start to see immunity. We will still wear masks and we will still be very careful, but we'll be able to be confident that we will not die from this infection if one of our patients, God forbids, infects us. And by the way, some of my doctors have been infected and have been hospitalized because of that. Allison?
Well, Dr. Lahita, we wish them the best and hope they're all doing okay. Let me ask you, Pfizer vaccine says its vaccine is 95% effective, but it was not tested on pregnant women or children. Who is this vaccine right for, and who should maybe hold off or talk to their doctor first?
Well, that's a loaded question. First of all, anybody who's hyperallergic to medications, et cetera, should not get the vaccine and without consulting with their doctor, because there have been reports in England of anaphylaxis in very few people, like 1 or 2, but nevertheless, that is a concern, and that's normal. That's expected when you vaccinate hundreds of thousands of people. So that's number one. Secondly, I think the last group that's going to be recommended for vaccination are young people below the age, say, of 15, maybe even 18, down to children, because they are the least affected by this virus. And so they will not be, they will eventually be immunized. And Pfizer is currently doing research on about 100 to 200 young people to see what the placebo and vaccine does to infectious rates in that subgroup. With regard to pregnant women, they have to consult with their gynecologist. They should not get the vaccine right off the bat. We simply have no data regarding pregnant females being vaccinated. Now, that's interesting because whooping cough and influenza we recommend in pregnant women. And as you know, a pregnant woman gives her immune system to the baby for a period of about 6 to 7 months after birth. So it would seem reasonable to assume that if someone got vaccinated and was immune and was pregnant, that would be a good thing. But there's no data, and they're being very, very careful. And I'm sure this topic is right before the FDA advisory board as we speak now, at this moment. Allison?
Dr. Lahita, a member of the FDA's advisory committee said today that the vaccine side effects need, quote, open and even-handed discussion. We saw possible allergic reactions to the vaccine in the UK. Is there any chance that that could hold up the approval process here in the U.S.?
I don't think so, Allison, and I'll tell you why. Because statistically speaking, you should expect some adverse reactions in some people in the population, a very minuscule amount. The number of allergic responses that are not good for people are going to be so minuscule compared to the benefit that the vaccine offers everybody, the risk-benefit ratio, as we call it. The risk of having an allergic reaction is so minute that if the vaccine is given in a healthcare facility, that can be overcome. We have vaccination reactions all the time that we handle in our clinics, in our offices. Something as bad as anaphylaxis is easy to treat once you identify it. And if the vaccine is being given in a healthcare facility by nurses, doctors, and other competent individuals, that kind of allergic reaction is easy to handle. So people should not be worried about that. By the way, that's an immediate reaction to the injection. Allison?
Dr. Lahita, Hanukkah starts at sundown tonight. What is your best advice for all of our Jewish viewers looking to celebrate this holiday with family and friends, and for all of our viewers who want to be with their friends, want to be with their families over whatever holidays they celebrate this December?
Yes, as I said, Allison, over Thanksgiving, you've got to be careful. Celebrate only with your immediate family that you know are healthy. Make sure if you have relatives coming from afar, that you make sure they have no symptoms, no dry cough, no sniffles, no muscle aches or pains, and certainly no fever. Now, some people actually have a thermometer, either digital or otherwise, which they use to take the temperature of guests arriving for dinner, for example. I don't know if that's a good thing to do, but I think it is a good thing if you're worried about having somebody pass an infection on. Now, I know of many gatherings at Thanksgiving where after the fact, a relative was found to be positive, resulting in everybody during the Thanksgiving dinner, regardless of their number, going into quarantine. So you really have to think that whoever comes from the outside, particularly from other parts of the state or out of state, for Hanukkah celebrations or even Christmas celebrations going forward, that they are potentially infected, even though they feel good and they look good. Be careful. You never know. So wearing a mask, social distancing, etc., might not be the good thing for your Hanukkah celebration, but if the patient has any risk of infection, it's a safe thing to do. It's better to be careful than sorry. Allison?
Yeah, absolutely, Dr. Lahita. There's a whole lot of risk out there. Important to be careful. Thank you so much for coming on. We always appreciate having you here.
Thanks, Allison. My pleasure.
The Pentagon expecting to get about 44,000 doses of Pfizer's coronavirus vaccine in the coming days. It will go to 16 locations around the globe, mainly to healthcare workers and first responders. But those thousands of doses only cover about 10% of that workforce. NBC News Pentagon and National Security correspondent Courtney Cubey explains how this initial batch of the vaccine will be distributed.
Allison, the Pentagon announced earlier this week that they will receive their first batch of doses of the coronavirus vaccine made by Pfizer as early as next week. Now, they expect to get just under 44,000 doses of the vaccine in this first group. Those will be prioritized. The first group getting them are healthcare workers, some first responders, and interestingly enough, a very small group of key senior military leaders. That includes Acting Secretary of Defense Chris Miller, his deputy David Norquist, and the chairman of the Joint Chiefs, General Mark Milley, and the vice chairman, General Hyten. They will all receive the vaccine in this first tranche of doses. The reason for that, according to the Assistant Secretary of Defense for Health Affairs, Tom McCaffrey, is that they're hoping that seeing senior leaders get the vaccine will encourage other members of the military, that's both uniform and civilians, and it also includes their families, retirees, anyone who receives military health care. They want to encourage them to get the vaccine. It is not mandatory for the Department of Defense population to get this vaccine. The reason being, according to Assistant Secretary of Defense for Health Affairs Tom McCaffrey, is because it will have received an emergency use authorization by the FDA. It has not gotten that yet, but the expectation is it will. Because it's an emergency use authorization, they are not requiring people to get it, but the Pentagon is strongly recommending and encouraging people to get it. So the first group of those roughly 44,000, those are going to go to 16 different locations around the world. 13 of them are in the United States and in Hawaii, continental U.S. and in Hawaii, and 3 are overseas in Germany and in Asia. And they will be prioritized or prorated based on the size of the population that is in the area that they may need to provide the vaccine to. It's also important to point out, though, that even though they're getting these 44,000, that will only cover about 10% of this first group of people. So of healthcare workers and first responders, this critical group that will receive it first, only about 10% of them would be covered by that 44,000. The big question is how many of them will actually take it because it's voluntary. Allison?
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.